Hi, I'm Dr. Hans, and this is the fourth session of Whiteboard Wednesday. Today we're going to discuss trunk stability, or as most people know it as core stability. I prefer to use trunk stability because every time you say core, people start to roll their eyes and there's so much misinformation. Most people think that core training is anything that makes the abdominal wall burn. They're doing planks, they're doing all things without properly setting it up, which we're going to cover later. So if we look at the core stability or trunk stability, the history of it. In the beginning, as we say, everybody thought they was doing lower back, abdominal muscles. Then we had the component, but everybody thought, okay, we have to do instability training. We have to try to keep ourselves stable. What does research say about that? Well, most of the muscles used are erectors, the lower back muscles, and abdominal muscles, the rectus abdominis, which is basically the two muscles we don't want to work. Then after that, we had the whole Hodges and his team that worked on, they identified the four important components of trunk stability. Unfortunately, the focus ended up on transversus abdominis, so we had this hollowing phenomena, and people refer to it as the Australian, but this actually, they were very, very right. They've done a lot of fabulous research on it. We know now that hollowing is inferior to other strategies. Today, most people think that we are looking at more of a bracing pattern. You brace yourself if someone's going to punch you in the stomach. And unfortunately, that means that you just recruit the muscles from the outside again. We're not treating it as, if you look at definition of core, it means center, middle, and we're not using the middle at all. And that's where this new method comes in. It basically involves creating a pressure, an intra-abdominal pressure that actually supports the spine from the front. So if we're looking at what we want to do, we want to have a pressurized ball in there. It is, as we say, I can symbolize that. This can symbolize the spine, and if we can bend any of these links, we get a sharp bend in it, which basically is no, that's when we get injuries. If I can have the intra-abdominal pressure, please. Thank you. If we now take that chain and we bend it over the ball, there are no sharp bends in it, and that's how we protect the spine. We know also that the trunk stability is something that should basically come before any other movement. The Hodges study shows that we got the feet forward just by thinking about moving the arm. Are we activating these structures? So if we have them working in the proper way, they're going to help us. If we have a dysfunctional pattern, it's going to turn it the other way. So basically, how do we create this intra-abdominal pressure? Well, we're going to introduce to you your new best friend. It's called the diaphragm. So the diaphragm is your main breathing muscle. Sits in between the chest cavity and the abdominal cavity. When you take a breath in, the diaphragm drops down, which reduces the pressure inside the thoracic cavity, and air would rush in, fill your lungs up. There are no muscles in your lungs that suddenly, they're just a passive action created by difference in pressure. When that happens, the diaphragm will move down and to compress the cavity and support the spine, so you basically get the support from the front. As we will see, it is unfortunately very, very common for people to change this pattern. And there are different reasons. There can be just a lot of pain, a lot of stress, a lot of all these factors that change our breathing patterns. And what are the signs? How can we see that these people have got, they're usually having a high chest cavity like this because they are chest breathers. Chest goes up and down, When we do normal breathing, there should just be a little expansion of the rib cage, no upward and downward movements in it. And these people are also usually having a pelvis dropping forward because they stabilize themselves with these muscles. So the back muscles are on all the time. They come to practitioners, they got tense, they're sore, they're painful in the back all the time because they're using them constantly. Then we've also got those people that have got a incorrect breathing pattern, usually don't activate the oblique chains coming to the abdominal, so they're having flaring ribs sticking up here. The angle of the collarbones are almost horizontal instead of, you can see the neck muscles are active. So this is where it all starts. And you will see when we go through the rest, it all going to sort of go back into step one. And that's what we're saying, that to restore function is like building a house. You have to start with a foundation. That's your foundation. So it's basically got three functions. It's the main respiratory muscle, but it also creates stability. And it's got the third function, it works as a sphincter for the esophagus. So the people that have problems with this, very often also having acid reflux as an extra bonus to suffer from. So out of those three functions, the one we're going to concentrate on is the stability function and the respiratory function. And we got two very interesting studies done by Pavel Kolash and his team. And it shows that you can do stability function without having the respiratory function. So they use spirometer, they measure that there's no breathing, they put the loading on, resisting lifting the legs, the diaphragm kicks down to create that pressure. The second study shows that it can do both of these functions simultaneously. So if we can actually maintain your breathing pattern while it creates the stability. And basically what happens there is that the diaphragm normally would go from there to there. Now it learns to just go from there to there. So you got a slightly shallower breathing, but you create stability at the same time. And that's why you probably have seen I created a dial where you got breathing function, stability function, and it's all depending on your daily task, what you're going to do. If you go for a run, you just have to keep your breathing function well. If you are a chest breather, you are even going to impair your ability to do proper breathing function. If you're going to lift a maximum lift, you're basically interested in stability function only. That's why lifters take a deep breath in, hold that breath to create that pressure, do not let the breath out until they have succeeded. Most of our activities are created all along the line, and depending on what we do, and when we start to practice, you will see you're using too much effort because it's a new pattern. As you work on this, it'll get easier and easier. One thing we have to be cautious about, and that is that the brain will always favor a breathing function. So when we get out of breath, we will lose stability. That's why cardio fitness is actually very important. If you got good capacity, you can also keep stability for longer, which is if you are an athlete in a contact sport, you're a crossfitter, you're a strongman, you better make sure that you work on both these functions at the same time. And if we look at the whole ability of wearing a belt. The weightlifters wear a belt, not for the back, for the front, to take a deep breath into, to create that extra pressure, because those belts are much stronger than the abdominal wall. And we also see for most people, if they put that belt on, slightly loose, and then breathe in to pressurize, to basically try to burst the belt. I used to stick my fingers in at the back, and I get them to sort of squash my hands. So they put a belt on people, that's the first time they really feel, that's what you want. All right, I think that is enough for today. Thank you for watching. This was the 4th session of the Whiteboard Wednesday. And I hope you tune in to the next one, where we're going to start to discuss the spine. See you next time. Exercises, there is so much information. Now we're going to bone it down into No, don't bone it down. No, but take it down in.